part 2 of the film and processing lecture. So I'm going to go ahead and get started. Hopefully you've already watched part 1 where we talked about film in particular. We're picking back up after the first 6 objectives with number 7, identify types of intra and extraoral radiographs and when they would be indicated. And for intraoral, you've got the most common type is going to be the bite wing radiographs. And again, that is showing you an image of the crowns of the maxillary and mandibular teeth in occlusion. You can take posterior bite wings, which are the most common, but some offices also take an anterior bite wing image. You can take typically horizontal bite wings, meaning that your film or your sensor is laying horizontally. But there are times if you've got a periodontally involved patient and they've got a significant amount of bone loss, you actually would take a vertical bite wing, meaning that the film or the sensor would be standing up vertically to allow you to see a taller view. You would get more bone on either side of the maxillary or mandibular if they had that bone loss. But like I said, the most common is the horizontal posterior bite wing. So just kind of keep that in mind. Those are typically taken about, once a year, depending on the practice and the dentist's preference, depending on, the patient's condition and how stable they are or how often they're having to monitor. Bite wing images show you the interproximal surfaces of the maxillary and mandibular teeth together. So they're great for looking at caries, looking below the contact for any caries or calculus buildup. They're also great because they give you a very natural view that's really representative of the bone height. They give you a good indication of the bone height and the periodontal health along with that. Another common intraoral image is going to be a periapical image. Periapical images show you the crown and the root and the area around the root and the supporting structures of the tooth. It's actually called a periapical, which means around the apex. So you're looking for that supporting structure around the apex of the root of the tooth. And typically it's an individual tooth or a couple of teeth in sequence that you're looking at in a periapical image, and you're looking for overall health of the tooth. You're looking at the crown of the tooth and the root for health. You're also looking for any periapical lesions, abscesses, granulomas, things like that that could be occurring around the root of the tooth, not visible clinically. Often when patients come in, if they're having a toothache or a symptomatic tooth, you'll just take an individual periapical of that tooth, or if the dentist may want you to take a periapical of that tooth along with a bite wing of that area. And so that would give them a good indication of the health overall of that tooth. Another type, not as common, of intraoral image is an occlusal. Occlusals are typically done if you're looking for larger areas of pathology or if the patient has a limited ability to open. So you'll see occlusals with injury type patients, and also a good bit of a great deal of pediatric images would include an occlusal. Again, just because of limited ability to open. Another good use for an occlusal image, if you were trying to locate whether an object like a foreign body or an impacted tooth, whether it's facial or lingual in its location, an occlusal would show you that the teeth in alignment, and then the object that you're trying to locate would appear either lingually or facially compared to those. Those are the most common types of intraoral images. I'm going to skip extraoral radiographs for now in this lecture because it has its own lecture later in the semester. So we'll come back to the extraoral and their indications later. Number 8 objective is describe proper film storage. Film storage, typically they like to be at room temperature or a little colder. So kind of as a rule of thumb, 50 to 70 degrees Fahrenheit is the temperature that they like, and 30 to 50% humidity. What that means is film doesn't like to be stored where it's going to be hot or very humid. So the worst place in a dental office that you could store film would be directly above an autoclave where it would be venting steam. With the heat, remember, film doesn't understand and doesn't distinguish between different types of energy. So it doesn't know the difference between heat or x-rays or light. It just recognizes that energy has come in contact with it. So if it's exposed constantly to heat, then your images, when they do come out, they're going to be very dark because they were already exposed to kind of a base layer of energy from the heat. Humidity, remember we talked about in part one the different parts of the film packet? Well, that black paper that's supposed to help protect from moisture and light leaks, or protect it from light leaks specifically, if it gets too humid, the film becomes sticky, that protective layer becomes sticky, and the paper will actually stick to the film itself. So humidity is bad. Too much heat is bad. Under 70 is preferred. Another thing to keep in mind with film storage is that x-ray film does expire. So when you get new film in, make sure that you don't just put it in the front and use the newest first. Make sure that you put it in the back and rotate your stock so that you're using the older film first. I always compare this to if you notice that you're getting low on milk and you buy a new gallon of milk and you sit it in front of the other, what was left of the other gallon. Well, you start drinking that second gallon. When you get get kind of low on that, you go buy more milk and you put it in front. Well, what happens to the milk in the back that's just gotten pushed back and pushed back is it just keeps getting older and older and funkier and funkier. So make sure that when you're buying new x-ray film or milk, take the new, put it behind so that you finish using that older film first before it expires and goes bad. Remember that extraoral films are used in cassettes, and so you have to have the box of film in an area stored so that you can take the film out of the box and put it into the cassette, because that film is not individually packaged. So if you take the lid off of the whole box, it has to be in a dark room condition or it's going to expose that whole box of film. Defining the essentials of a dark room, which is number 9 objective. Mainly, you have to have a normal electric light. You have to be able to turn on the light to see and get everything set up in there. You have to have a safe light, which is the filtered light that you're going to work under while you're opening your films to be processed. You have to have a processing unit, and I don't think anybody uses manual processing anymore. They're to the automatic processors, but you have to have a processor in there. You need a sink and then brushes to clean the processor. Often that's not in the actual darkroom, but it needs to be somewhere close because those rollers and tanks have to be cleaned frequently, and so you have to have access to be able to do that. Those are the things you have to have. Things to think about while you're designing and setting up a darkroom. There has to be enough space to work. In a lot of offices, the darkroom is essentially a closet, and you just go in and you work in there and it's fine. But you need enough space to work. You need ventilation. These chemicals do smell quite strongly, so you need ventilation. And also a place for storage and supplies. Again, like the sink, it doesn't have to be in the darkroom, but it has to be close enough that it makes it easier to work in the darkroom. Objective number 10, describe the function of the safe light filters and the requirements for their use. I always say, as far as the requirements for their use, refer to the box of your extraoral film and your intraoral films. Look at those and make sure that you've got a safe light that's compatible with your film, or that your film, if you change film brands, make sure it's compatible to the light that you have. because every box will tell you what those requirements are. The most common two types of Safelite filters are a Morlite 2 and a GBX2. Again, it's just different manufacturers, but those are the most common. And that is what gives you that red tone to the light. You need a minimum of 4 feet distance between your working area and where your Safelite is mounted. Even a Safelite, that's kind of a misnomer. Even the Safelite will expose your film if it's open too long. So you need 4 feet away, and you need to work kind of quickly to get those films into the processor once they've been opened. And then the light bulb requirement is 15 or a 7.5 watt bulb, which is a very dim light. And then you put those GBX2 or Morlite 2 filters in front of it, and that's going to be the proper lighting, as long as that's adequate with the film that you're using. But again, about 2.5 minutes to 3 minutes is about as long as you want to have film open and exposed, even to Safelite. Other than that, it's going to start to expose your films. Okay, we're going to scroll these up a little bit. Number 11, define the proper time and temperatures for manual and automatic processing. And I actually have a diagram for you for that. I started out up here in the top. You've got the developer and fixer, just a very quick, basic explanation of what those are. The developer softens that emulsion. It reduces those silver halide crystals or silver bromide crystals into metallic silver. That's what's going to give you the radiolucent areas in your image. And then the fixer stops the developing, and it removes any of the undeveloped, meaning unexposed, silver bromide crystals and cleans them away. That's what gives you the radiopaque areas. Radiopaque is actually clear to a certain extent. And then it rehardens the emulsion to make the image permanent. Okay, we'll scroll this up a little bit. This is just a breakdown of film processing, what the different chemicals do. I've given you both the manual and the automatic. Whoops. Skip down, I didn't mean to. I've given you both the manual and the automatic processing times and temperatures. National boards like to ask you these. Again, I don't know anybody who uses manual processing, but just in case they ask, I wanted you to have that information. So the developer is 5 minutes at 68 degrees Fahrenheit for manual processing. And then you have a 30-second rinse. It goes through the fixer, which is the second chemical, for 10 minutes, and it's always twice as long for manual. So fixer for 10 minutes, and then a 20-minute wash, and then you have to let them dry or put them in a dryer. For automatic, you'll notice the times are shorter, but the temperatures are also higher. So with automatic processing, you've got more concentrated chemicals that work at a higher temperature. So the developer is 1.5 minutes at 80 degrees Fahrenheit. There's no rinse in between that goes through squeegees. So then you've got fixer for 1.5 minutes, a wash for 30 seconds. It goes through heated blowers for 30 seconds to dry it. So in a total of about 4.5 minutes, your film comes out ready to go from the automatic processor. But you'll need to know those times and temperatures for exams and the order. But I've given you just kind of a basic diagram to show you how these work. Your film would be fed into the processor. It dips down into the developer. It squeegees out, dips down into the fixer, squeegees out, goes through the rinse and then the heated blowers, and your films come out the other side. So that's your automatic processor. I've also got you a manual processor visualization here. And it just shows you the tank. You would have a fixer tank and a developer tank with the water wash in the middle. And so you would put it into one tank, take it out, rinse, put it into the second tank, take it back out, rinse, and then hang it to dry. Okay, so those are your times and temperatures for manual and automatic processing. And I also went ahead while I was in that diagram and showed you the functions of the different solutions. A couple other things I wanted to show you. just while